Hello, my name is Mary Tibma, and I am the Manager of Customer Engagement and Experience for the Department of Family and Medical Leave. Today, I'm joined by my colleagues, Katie Schooling and Steve Crowder. Thank you for taking the time out of your busy schedule to learn about the changes that DFML has made to the certification of your serious health condition form. We heard from healthcare providers loud and clear and made changes that we hope will save you time and effort. Just a little compliance reminder before we get started. The information provided in this presentation is current and accurate as of the original date of the presentation. If you are reviewing or listening to the recording at a later date, please be aware that we cannot guarantee that the content will remain accurate for all future dates. Today's presentation is focusing on certification requirements for medical leave. This is when a patient is applying to take leave for their own serious health condition. As you know, there is another certification form that is used when a relative wants to take leave to care for one of your patients. We will be reviewing PFML leave types and certification requirements, improvements to the certification of your serious health condition form, and based on suggestions from medical providers, we are going to share some examples of how you fill out the form for various medical situations. And lastly, we'll provide you with some resources that you and your team can refer to if you have questions. I'd like to start out by giving you a brief overview of the types of leave that are available under the program. PFML provides temporary income replacement to eligible individuals who are either welcoming a new child into their family, struck by a serious illness or injury, need to take care of an ill or ailing relative, are managing affairs while a family member is on active military duty, or caring for a family member who was injured serving in the armed forces. Just want to note here that the first examples I gave you are eligible for up to 12 weeks of paid family leave. The last example, where you're caring for a family member who was injured serving in the armed forces, that leave is available for up to 26 weeks. This graphic shows how these leave types are divided into two categories, family leave and medical leave. As I mentioned, family leave can be used for either bonding with a newborn child, an adopted child, or one that is placed through foster care. Parent can take that bonding leave within the first 12 months after a child's birth, adoption, or placement. Family leave also includes caring leave to provide support for a family member who has a serious health condition. And lastly, there's active duty leave, where an individual can take leave to manage the affairs of a family member who's on active duty. For these leave types, an eligible individual can take up to 12 weeks of leave. Another kind of caring leave is the leave to care for a family member who was injured serving in the armed forces. And as I mentioned, in this scenario, an individual would be eligible for up to 26 weeks of paid family leave. The important thing to recognize here is that regardless of the type of family leave you take, or the combination of family leave that you take, you can only take up to a total of 12 weeks in one benefit year. So again, that can be all taken as one type of family leave, or it can be a combination of any of those three leave types. The other type of leave we have is medical leave, and this is to care for your own serious health condition, and you can take that leave for up to 20 weeks. Another important thing to mention here is that there is a maximum of 26 weeks that can be taken for leave in a benefit year. That can be any combination of family and medical leave, combining either up to 12 weeks of leave for family leave and then up to 20 weeks for medical leave. So again, the maximum amount of time that you can take the PFML benefits within the course of a benefit year is 26 weeks. In addition to taking leave for different reasons, individuals can also take leave on different schedules. There are three types of leave schedules. The first type of schedule is a continuous or full-time leave. In this situation, the individual is taking a single block of leave usually for an extended period of weeks or months. This might apply in a case where somebody is out due to a surgery, or in family leave cases where a parent is bonding with a new baby. The second type of leave is for reduced or part-time leave. This individual will take a regular leave schedule that is less than their full working schedule. This could be a leave schedule where they might be taking certain days off every week. For instance, they might work Monday, Wednesday, Friday, and take off Tuesday and Thursday. If they normally work a Monday through Friday schedule, they could also take half days or reduced days. For example, they might be working 4 hours a day instead of 8 hours a day. And lastly, there is intermittent leave. This is a bit more confusing than reduced leave because while reduced leave follows a regular schedule, intermittent leave may be periodic, episodic, and unpredictable. Intermittent leave occurs when an individual needs leave in any other block of time other than a single block of time or a regular schedule. This can involve multiple long periods of leave. For instance, if somebody has flare-ups of a condition and might need a week at a time. It can also involve chronic conditions, migraines, or other situations where an individual might need a short period of leave at a time. When your patient applies for medical leave, you will need to provide the following: confirmation that your patient has a serious health condition and is incapacitated from doing their job, when your patient's condition began, an estimation of how long your patient's condition will continue and how long they will be unable to work, and any other relevant details about your patient's condition, such as symptoms, prescriptions, or a regimen of care. One thing that I'd like to address is how DFML handles medical leave that results from pregnancy and childbirth. This has been a problem area, and it's important to note that a birth mother can take leave either before or after childbirth if they have a serious health condition that results from pregnancy and delivery. And then they are still eligible for family leave to bond with the child. The birth mother can take leave anytime during the first year after the child's birth, adoption, or foster placement, but it is financially advantageous to take it right after medical leave so they don't lose an extra week of benefits due to the waiting period. I want to give you a few suggestions to set your patient up for success if they are pregnant and preparing to take leave. You should discuss your patient's ability to do their job during their pregnancy or after childbirth. And if they're hindered from working, certify your patient's serious health condition by filling out the certification of your serious health condition form. If your patient is wanting to take family leave to bond with the child after their medical leave, the patient should follow the 2 steps provided here. They should call the contact center within 14 days of their child's birth to avoid a second waiting period. They should also provide proof of birth with their application. DFML will accept a variety of types of documentation: a copy of the child's birth certificate, a statement from the child or mother's healthcare provider with the child's date of birth, or a hospital statement of birth records. I do want to note that as the medical provider, you are not involved with your patient applying for family leave. They will work with our contact center to provide the date of birth, but there is no documentation that is required from you. Now we're going to get to the heart of this presentation. We want to tell you about the changes we have made to the certification form and give you some examples of how we want you to fill out the form under specific medical circumstances. This form is required for medical leave due to an employee's own serious health condition. This form is not required for family leave to bond with a child within the first 12 months of birth, adoption, or foster care placement. It is not required for active duty leave to manage family affairs when a family member is in the armed forces. And lastly, It is not required for family leave to take care of a family member who has a serious health condition. And now I'm going to turn this over to my colleague, Katie.
Thank you, Mary. So I'm going to go over the improvements that we have made to the certification of your serious health condition form. First and foremost, we have reduced the number of pages you have to fill out from 4 to 3. And this includes the signature page at the end. In addition, we have eliminated the need to initial each page of the form. We heard that this was definitely something that a lot of medical providers could not get to or was often left off the page, so now it is no longer a requirement. In addition, we streamlined the questions on pregnancy and childbirth so that they're easier to read. We also included some information in the helper text about the difference between this form for medical leave for pregnancy and childbirth and family leave to bond with a child, which does not require this form. In addition, we combined open text questions. These were on 2 separate pages and often caused confusion. And now they're on the same page right next to where you describe the patient's serious health condition. And we also used some of the language from FMLA here and cleaned it up so that it's easier to fill out. And last but not least, we provided a much simpler format for scheduling continuous, reduced, and or intermittent leaves. This is the old form. It's 2 pages. We've reduced it to 1 page, and we've made it a lot easier to show that, 1, you can have more than 1 schedule. So you can pick 1, 2, or all 3. In addition, we made it much easier to fill out so that you know that for the continuous leave, you just need the dates. For reduced leave, you say, what do you think the employee or your patient can actually work? And for intermittent leave, just the duration and frequency of the flare-ups that might happen for a condition that needs intermittent leave. So just to reiterate, we reduced the number of pages to 3 instead of 4. We eliminated the requirement that each page needs to be initialed. We streamlined questions across the board, but especially around pregnancy and childbirth. And we provided a simplified format for scheduling for continuous, reduced, and intermittent leaves. So now I'm going to turn this over to my colleague, Steve, who's going to go through examples of how to fill out the form for different conditions.
Thank you, Katie. I would now like to provide you examples to help assist in filling out the certification of your serious health condition form. The information in these examples is for informational purposes only. The story and names are fictitious, and no identification with actual persons is intended or should be inferred. In our first example, Sarah is having her first child and needs 4 weeks of continuous medical leave prior to giving birth because of complications. Her expected delivery date is July 1st, 2022. She will start her medical leave on June 2nd, 2022, and after the birth of the child, the patient will need 8 weeks of recovery time because of a planned C-section. The following is how the certification of your serious health condition form should be filled out. The employee, your patient, who is applying for paid leave should complete Section 1. You can see in this example the patient has filled out their information. Also, the patient should write their name on the top of the page 4 through 6 of the form. You, as a healthcare provider, should complete sections 2 through 4. In Section 2, Question 7, select all the criteria that apply to your patient's serious health condition. You can see in this example, multiple boxes are checked off. In Question 8, check yes, the patient should refrain from work because of childbirth and recovery. The patient is unable to function at all at work, so that should be put on the second line. In Question 9, check no, the health condition is not work-related, and in Question 10, check yes, the patient's condition is related to pregnancy and the patient needs time off due to their serious health condition related to pregnancy and the patient needs time off due to their serious health condition related to childbirth or recovery following childbirth. And you'll notice both of those are checked off. And in question 11, please fill in the expected delivery date. In this example, the expected delivery date is July 1st of 2022. In section 3, provide your best estimate on what type of leave schedule will be needed. In this example, the patient will be on continuous leave from June 2nd of 2022 until August 26th of 2022. Complete section 4 with your information. And then once you have completed the form, return it to the patient. In this example, Helen recently suffered a shoulder injury on May 2nd of 2022. She does not need surgery, but she will need to have intensive physical therapy as part of her recovery. Helen will have 3 1.5-hour sessions each week for 6 weeks. As a result of her physical therapy appointments, Helen will miss 4.5 hours of work per week for 6 weeks, which is reduced leave. The following is how to fill out the certification of your serious health condition form. The employee, your patient, who is applying for paid leave should complete section 1. You can see in this example the patient has filled out their information. Also, the patient should write their name on the top of page 4 to 6 of this form. You, as the healthcare provider, should complete sections 2 through 4. In section 2, question 7, select all the criteria that apply to your patient's serious health condition. You can see in this example, multiple boxes are checked off. In question 8, check yes, the patient should refrain from work due to treatment for injury. The patient is unable to attend work during treatment. In question 9, check no, the health condition is not work-related. And in question 10, check no, the patient's condition is not related to pregnancy. And leave question 11 blank. In section 3, provide your best estimate on what type of leave schedule will be needed. In this example, the patient will be on reduced leave of 4.5 hours per week from August 1st of 2022 until September 12th of 2022. Complete section 4 with your information. Now that you have completed the form, return it to the patient. In this example, Janet has breast cancer. She will have surgery, then weekly chemotherapy infusions, then radiation every day for 7 weeks. She will have long-term follow-up appointments and tests for the next several years. Janet will take 4 weeks of continuous leave for her surgery from July 1st, 2022 to July 29th, 2022, followed by intermittent leave, 1 to 5 days off per week per absence, up to 1 day, 8 hours per absence from August 1st, 2022 to June 30th, 2023. The employee, your patient, who is applying for paid leave should complete section 1. You can see in this example the patient has filled out their information. Also, the patient should write their name on top of page 4 through 6 of the form. You, as a healthcare provider, should complete sections 2 through 4. In section 2, question 7, select all the criteria that apply to your patient's serious health condition. You can see in this example, multiple boxes are checked off. In question 8, check yes, the patient should refrain from work due to surgery, treatment, and follow-up care for cancer diagnosis. The patient is unable to function at all due to their condition. In question 9, check no, the health condition is not work-related. And in question 10, check no, the patient's condition is not related to pregnancy. And leave question 11 blank. In section 3, provide your best estimate on what type of leave schedule will be needed. In this example, the patient will be on reduced leave and then intermittent leave. The continuous leave will run from July 1st of 2022 to July 29th of 2022. The intermittent leave will roughly run from August 1st of 2022 until June 30th of 2023 for up to 5 days per week and up to 8 hours per occurrence. Complete section 4 with your information. Now that you have completed the form, return it to the patient. In this example, Bob has colon cancer. He will have chemotherapy every 3 weeks for 4 months. Bob is not sure how well he will tolerate chemotherapy or what treatment he will need after finishing chemo. Bob will take intermittent leave, 1 to 5 days off per week, up to 1 day, 8 hours per absence, from July 1st, 2022 to June 30th of 2023. The following is an example of how the certification of your serious health condition form should be filled out. The employee, your patient, who is applying for paid leave should complete section 1. You can see in this example the patient has filled out their information. Also, the patient should write their name on the top of page 4 to 6 of this form. You, as a healthcare provider, should complete sections 2 through 4. In section 2, question 7, select all the criteria that apply to your patient's serious health condition. You can see in this example, multiple boxes are checked off. In question 8, check yes, the patient should refrain from work due to their cancer diagnosis, chemotherapy, and follow-up treatment. The patient is unable to function at all due to their condition. In question 9, check no, the health condition is not work-related, and in question 10, check no, the patient's condition is not related to pregnancy, and leave question 11 blank. In section 3, provide your best estimate on what type of leave schedule will be needed. In this example, the patient will be on intermittent leave from July 1st of 2022 to June 30th of 2023. The intermittent leave will take place from July 1st, 2022 until June 30th of 2023, and the episodes of incapacity are estimated to occur up to 5 times per week and are most likely to last 8 hours per episode. Complete section 4 with your information. And now that you have completed the form, return it to the patient. In this example, William has been evaluated by a behavioral health clinician and has been diagnosed with a major depressive episode. William does not need hospitalization at this time, but will need 4 to 6 weeks continuous medical leave to allow his antidepressant medication to become effective and to attend twice weekly psychotherapy sessions, either as an outpatient or via telehealth. He will also need to be monitored for suicidal thoughts or plans during this time. The following is how the certification of your serious health condition form should be filled out. The employee, your patient, who is applying for paid leave should complete section 1. You can see in this example, the patient has filled out their information. Also, the patient should write their name on top of page 4 to 6 of the form. You, as a healthcare provider, should complete sections 2 through 4. In section 2, question 7, select all the criteria that apply to your patient's serious health condition. You can see in this example, multiple boxes are checked off. In question 8, check yes, the patient should refrain from work due to needing time off for medication to become effective, attend twice daily sessions, and will need to be monitored during this time. The patient is unable to function at all due to their condition. In question 9, check no, the health condition is not work-related, and in question 10, check no, the patient's condition is not related to pregnancy, and leave question 11 blank. In section 3, provide your best estimate on what type of leave schedule will be needed. In this example, the patient will be on continuous leave from August 5th, 2022 to September 16th of 2022. Complete section 4 with your information. And now that you have completed the form, return it to the patient. And even though we have created this new form with improvements, we will still accept the old form. Thank you. This completes the examples of how to fill out the certification of your serious health condition form for your patient. I will now turn it over to Mary for closing remarks.
I wanted to conclude by providing you with some resources that you can refer to if you have questions about the forms or the process. The most important resource that we have for you is our website. The website is mass.gov/DFML. On our homepage, look for a button that will take you to the content that is devoted to medical providers. You'll find on the website some helpful links to healthcare provider responsibilities, a healthcare provider toolkit, and some frequently asked questions for healthcare providers. You may think that the contact center is only for questions from individuals applying for leave. That is not the case. Our customer service representatives take calls from medical providers as well. They are available to answer your questions Monday through Friday from 8 a.m. to 5 p.m. I should also mention that we have agents that speak Portuguese and Spanish as well as English, and we have a language line that can help with translations for up to 240 languages. I'd like to take this opportunity to thank you for listening to our presentation today. We hope that this information presents you with the information you need to successfully complete the program's required documentation. Again, many thanks for joining us today.